Feeling tired all the time, gaining weight without changing your diet, or maybe you're experiencing unexplained mood swings or hair loss. It might not just be stress. Your thyroid could be trying to tell you something. And one tiny hormone called TSH, or Thyroid Stimulating Hormone, holds the key to unlocking what's really going on inside your body. In today's video, we're diving deep into TSH, what it is, how it works, what your levels mean, and why it's one of the most important blood tests your doctor can order. Let's get into it. TSH stands for Thyroid Stimulating Hormone. It's a hormone produced by your pituitary gland, a small gland at the base of your brain. Now, despite being so small, the pituitary gland plays a huge role in regulating many of your body's functions, especially your thyroid. The thyroid is a butterfly-shaped gland located in your neck. It's responsible for producing hormones that control your metabolism, energy levels, body temperature, heart rate, and even how fast your body uses calories. So where does TSH come in? Think of TSH like a manager sending instructions. When your thyroid hormone levels are low, the pituitary sends out more TSH to tell the thyroid, hey, speed it up, we need more hormones. And when thyroid hormone levels are high, the pituitary reduces TSH levels to slow things down. This is part of a feedback loop, like a thermostat in your house, always working to keep your body in balance. Now, here's where things get interesting. Your TSH levels can tell doctors whether your thyroid is underactive, overactive, or functioning normally. If your TSH is too high, it often means your thyroid is underactive, a condition called hypothyroidism. That's when the thyroid isn't producing enough hormones and the pituitary keeps sending more TSH, trying to get it to work harder. On the other hand, if your TSH is too low, it may mean your thyroid is overactive. This is called hyperthyroidism. In this case, the thyroid is pumping out too much hormone, so the pituitary pulls back on TSH production to slow it down. It's like driving a car. If you're going too slow, you press the gas pedal. If you're going too fast, you ease off. TSH is your body's way of keeping your internal engine running just right. So, what's considered a normal TSH level? Most labs consider the normal range to be between 0.4 and 4.0 milli-international units per liter. However, some doctors prefer a narrower range, especially for people experiencing symptoms, even if their numbers are technically normal. Let's break that down. A high TSH, above 4.0, usually suggests hypothyroidism. A low TSH, below 0.4, might indicate hyperthyroidism. Somewhere between 1.0 and 2.5 is often seen as ideal by many endocrinologists, especially for people trying to conceive or dealing with autoimmune thyroid conditions. Keep in mind, the exact target range can vary depending on age, pregnancy, medications, and your overall health. Always interpret results with your doctor. So how do you know if your TSH might be off? Let's look at the symptoms of hypothyroidism, high TSH. Fatigue or sluggishness, weight gain, cold sensitivity, depression, dry skin, constipation. And here are common signs of hyperthyroidism, low TSH, anxiety or restlessness, weight loss despite eating normally, rapid heartbeat, heat intolerance, frequent bowel movements, difficulty sleeping. If you're experiencing several of these symptoms, it's worth getting your TSH levels tested. Now, you might be wondering, what causes TSH levels to change? There are many factors, including autoimmune diseases like Hashimoto's or Graves' disease, pregnancy and hormonal shifts, certain medications like lithium or steroids, pituitary gland disorders, diet and iodine intake. Even stress or illness can cause temporary changes. That's why doctors sometimes repeat TSH tests after a few weeks to confirm results. TSH is measured through a simple blood test, often included in a standard thyroid panel along with T3 and T4 hormones. If your TSH is out of range, your doctor might recommend medication like levothyroxine for hypothyroidism, lifestyle changes including diet and stress management, further testing such as thyroid antibody tests or an ultrasound. The key is not to panic. TSH alone isn't the whole picture, but it's an essential first step to understanding how your thyroid is doing. Your thyroid health affects your energy, mood, weight, and even your heart. Understanding your TSH level is a powerful tool in staying informed and in control of your health. If you've recently had a thyroid test or you're dealing with symptoms we talked about, don't ignore it. Talk to your doctor and ask questions. If you found this video helpful, hit the like button and don't forget to subscribe for more health content explained in plain English. And if you have any questions about TSH or thyroid health, drop a comment below. We're here to help. Thanks for watching and take care of your health. It's the foundation of everything else in life.